The campaign was to try and get wider access to out-of-hours mental health support. So we know that too many family members and individuals who are going through a crisis in terms of their mental health end up having to go to emergency departments where they can find it a very difficult experience. It can make their experience even worse when they have to wait hours and hours to be seen. And sometimes people actually get turned away and told that help isn't available. So we wanted to make sure that out-of-hours support is available for people with a mental health crisis, that specialist mental health support for those who need it is available across the country. And we ran the campaign using a lot of social media. We ran a petition. It achieved 22,000 signatures in the end. And we gave that petition to the then Minister for Mental Health. And we continued to provide a focus on what we called our hashtag In Our Hour of Need campaign on social media throughout last year. We ran an event about it early in 2018, and we were really pleased that because of the pressure that had been put on the government throughout the year, the minister then on foot of our event announced that he was extending out-of-hours services to 7 days a week for the 40% of the population that wasn't covered. So it was really a significant achievement in that thousands of people will have access to 7-day services that didn't have access to them before. As a coalition that advocates for better mental health system, it's quite clear that we wouldn't be able to do that public advocacy, that campaigning work, that raising awareness, as well as the work to hold public bodies and the government to account for their commitments without private philanthropy that was able to allow us that freedom to speak out in public. So while we get some core funding from public bodies, that funding is never going to give us that free voice to be able to raise issues and challenge government and its agencies to deliver on their commitments. So it's essential for us to have our impact. We can see from the 24/7 campaign, where we have been advising government for several years that this is what they should do, and we had given them all the evidence about it. We had given them the cost-benefit analysis, and still nothing was happening. And the only way that it actually turned into a commitment and turned into action on the part of that public agency was when we ramped up the public pressure. So without the Community Foundation for Ireland, we wouldn't have that change. Encouragement to us of mental health reform, that individuals would look at the work we're doing, would understand it, would understand the power of what we're doing in bringing together thousands of people who care about mental health, but who are, while we are making that concern more effective, more impactful, and more strategic. And so we're grateful, but we're also really pleased that our individual donors have seen the value of what we're doing. And we hope that they'll continue to feel that it's worthwhile to invest in mental health reform and our work so that we can keep making those improvements in the supports available to people.